Hi everyone, I'm Ifa, a pharmacy student from University of Brunei Darussalam. In this video, I'll be talking about something that you may have experienced yourself, which is dry eye and how to relieve it. So what is dry eye actually? Dry eye is a condition whereby a person does not produce enough quality tears to lubricate and nourish the eyes, which can result in symptoms of discomfort, visual disturbances, and inflammation of the ocular surface. So normally when you blink your eye, the tears will spread across the surface of the eye, which is known as the cornea. And then the tears will lubricate the eye, reducing the risk of infection as it washes away the foreign matter in the eye, keeping the cornea smooth and clear. Any excess tears will then be drained into the small drainage ducts at the inner corner of the eyelid here and back to the nose and to the back of the nose. If the drainage and secretion of tears are imbalanced, this may cause dry eyes. So there are two types of dry eye conditions. Aqueous tear division dry eye, whereby a person does not produce enough tears. And second one is evaporative dry eye, whereby a person produces tears but of poor quality. There are some other risk factors that can contribute to dry eye, such as age. So elderly people tend to experience more dry eye symptoms as it is a natural aging process. Gender. Women are more likely to experience dry eye symptoms due to hormonal changes during pregnancy, menopause, and use of oral contraceptives. Medications. So certain medications can contribute to dry eye. So if you just start a new medication and you start to experience dry eye at the same time, you might want to consult with your doctor about it. And certain medical conditions, such as people with autoimmune diseases or dermatological diseases, are more likely to experience dry eye, and people with inflammation of the eyelids or cornea may also experience dry eye symptoms. Environmental conditions such as smoke, wind, and dry climates may increase the evaporation of tears, which contribute to dry eye. Contact lens use, especially prolonged use, may contribute to dry eyes too. And eye surgery, such as LASIK surgery, can cause dry eye as it reduces the tear production. So people who complain of dry eye typically describe it as feeling scratchy or sandy as if there is foreign material in the eye. And they may also experience blurred vision or inflammation. They may also experience blurred vision or excess tears in the eye. So the main goal of treatment for dry eye by using medicine is typically starts with an over-the-counter product such as artificial tears or lubricating eye drops, also known as ocular lubricant. So how it actually helps in soothing dry eye is by adding artificial tears to supplement the natural tear production, and also to retain the natural tears in the eye to minimize the dry eye symptoms. So in this video, I will be just talking about one product of lubricating eye drop, which is the Eye Glow Moist Eye Drop. And if you are using contact lens and you wish to use eye drops, then make sure that the eye drops that you're using are contact lens friendly. This is because there are some preservatives in some eye drops that can discolor clear contact lens. And talking about preservatives, there is the risk of preservative toxicity. So if you are alarmed by that, you might want to use preservative-free eye drops, which are available widely. So for eye drops, regardless if it's an artificial tear or lubricating eye drops, it's basically applied the same way. So I will show you how to apply the eye drops. So first, make sure your hands are clean first, which I have done by washing my hands. Then you make sure not to touch the eye drop. I've already opened the cap. And then tilt your head upwards and using your index finger, pull your lower eyelid down to form a small pouch, and there you can put 1 to 2 drops into that pouch and close your eyes, open and blink once and close again for at least 30 seconds. And after that, make sure to recap it again. So I will show you how to do it. And that's it. Quite easy. So for this particular eye drop, you can use the eye drop for 1 to 2 drops in each application for up to 3 to 4 times a day. So if you notice that you're using it more than the recommended dose, or you experience the dry eye even after using it, or it become even more worse, then it's best for you to talk with your doctor for an alternative product. So for if it's the first time you're using an eye drop, it might alarm you when you experience a bit of a stinging or a blurred vision when you use the eye drop, but don't worry, it should go away soon. However, if you experience severe eye pain or redness of the eye, then please discontinue the use of the product and consult with your doctor. So make sure to store the eye drops in a place below 25 degrees Celsius and avoid direct light. So this is a very important note for all eye drops. Make sure to throw away the eye drops 4 weeks after opening it. There are other ways that we can do to reduce the likelihood of experiencing dry eye, such as reducing exposure to smoke, such as tobacco smoke, using humidifiers, especially during winter season, as it can help in increasing the humidity around the eyes, reducing the evaporation of tears. Blinking regularly, especially when you are reading or staring at a computer screen for a long time, and wearing sunglasses outdoors during windy days to reduce the evaporation of tears. And then there are many questions that come up when you're using eye drops, and I will just talk about 3 questions that I think are very commonly asked. So first is, how many drops do I actually need to use for dry eye? So 1 drop for each eye is actually sufficient enough to soothe dry eye. And the second question is something that I know that some people actually do, and that is, can I share my eye drops with other people? And the answer is no. Sharing eye drops can spread bacteria and infection, as in some cases, when you put the eye drop in, the dropper might touch the surface of the eye or your eyelash. So please do not share your eye drops with other people. And the third one is, why do I feel like I can taste my eye drop? So as I mentioned before, when you have excess tears in the eye, it will drain into the drainage ducts at the inner corner of the eyelids. And this can also happen when you're putting in the eye drop. So what you can do to prevent that is to gently press at the inner corner of the eyelids like so, after a minute of putting the eye drops. And I hope this will be helpful for you. And that is all from me. I hope you can learn something from this video and have a good day. Thank you for watching.